Hello, my name is Julia Robertson and I am the founder of Garland Therapy. Before I start, I would really like to thank Jack very much for your fascinating and wonderfully insightful talk. I too am very excited about integrative collaboration in our industry and really trying to address the challenges that we face, but through mutual understanding and respect for each other's expertise. And for the end game to enhance outcomes and experiences, not just for the dog, but also for their guardians and their family, which is just so important. And hopefully, because we're all working authentically and collaboratively on what everyone is passionate about, we can create a wonderful synergy. So let me now start and tell you a little bit more about who we are and what we do, and talk a little bit about how I feel we could work in closer collaboration with fellow professionals, and especially more with the veterinary fraternity. So before I get going, I want to say everyone at Garland and Garland Myotherapy has some very strict treatment protocols. Firstly, we only treat by consent or on referral. But the other really important thing is that we use choice as when we are actually treating a dog, which is very important. I'll come to that a little later. But that can give us very clear signals of where a dog is very uncomfortable or painful. So any dog that we cannot touch or cannot get near, we do not continue the treatment. We do still give environmental advice and home advice, but we send back to the vet for further investigation or pain trial. And I want to be very clear about that. The other thing is that if we don't see any significant change in between 3 to 4 treatments, then again, we refer back to the veterinary surgeon that is looking after that particular dog. And that's very important to make that clear before I start talking about what we do. So I've mentioned a choice-led treatment protocol. That is what we call positive pact. I'm not going to go into detail in that today. But the other thing we are going to talk about is the canine massage, biomechanics and rehabilitation. Just touch on that. The canine massage we use is very much myofascially based, and that is something that I will be talking about. So before I get going, declaration, no conflict of interest. The subjects I talk about are my original work. Sources about fascia have been cited, and I have used AI for one diagram. And this is it. So can we optimize interdisciplinary collaboration? I really hope so, because this picture is sort of the perfect picture. Because we may not all be in the same room, but we are all on the same page, or we should be all on the same page. We should be working towards enhanced health and support for the canine and also their family, as we are dealing with really complex cases. As Jack very clearly stated, pain and chronic pain is incredibly complex, and it's individualized too, obviously. No one person or one dog is going to experience the same pain as another. So everything does have to be individualized, but not just from that perspective, but every one of us perceives pain differently. So it is a very individual experience. And by working in a team, we can afford to look at those individual qualities. So what is very exciting is now this very widely known biopsychosocial integrated approach, which basically means looking at the whole dog's world. And that is so exciting. This is something at Garland that we always do. We look at everything that may be involved within the dog's life that is going to have positive and negative impacts on their physicality, because it is critical for us to know that, to know how we can help manage and support them. So I'll just go through a few here. The home environment is so important because the dog spends so many hours there. So things like slippery floors, it's something we've been banging on about for many, many years. I mean, Garland's been going now for nearly 25 years. And personally, I have treated thousands of dogs and seen the difference in adjusting and changing these type of facets to their life within a treatment program. So it's something that we do speak from years of experience about. Also, additional activities, whatever add-ons they may be doing, whether those again are good or bad for that particular dog, is something that we can also support and advise. The home physical challenges like stairs, the car, furniture, all of these things does have small or large implications on a dog's chronic physical health. Also, we like to talk about play styles because we've seen so many really, really difficult injuries where dogs have been T-boned, and that can be a two-way type of play style, but that can create a lot of trauma in the body. Also, the family dynamic, how does that work? Does a dog have time-out place? Are they fully involved? Are they not involved? Those sorts of things are also important. Looking at equipment along with exercise, how are they exercised, what is used to exercise and whereabouts, what sort of surfaces, but also the equipment, whether it's a collar, harness, does the harness fit properly? All of these things are added. Feeding bowl and water bowl accessibility. The feed bowl especially, but obviously the water bowl is just as important. But feeding for most dogs is the highlight of their day. So they've really got to be comfortable to put them in the correct neurological zone and state to be able to be as unstressed as possible so they can digest effectively and safely as possible. Now, I've seen a lot of dog bowls that are now raised too high. I think sometimes we're going a little bit to the other extreme. The best way of looking is looking at dog's posture when they're eating to see if it looks comfortable. And the neck should not be, in my opinion, unless it's specifically for that dog, too high off the ground. Sleep, that's just a whole day's subject in itself. Are they able to sleep? Are they getting the right restorative sleep and bedding? All of those things. And their history too, but going right back to when they were a puppy. Did the guardians have them as a puppy? What impacts they've had, and were they in a rescue home? Is history known? All of these things. I'm really trying to drill down on the type of exercise they had as a puppy, if known, any injuries that could be dating way back. And we really do dig right back in the history as far as we can go from memory or any sort of notes or anything that we can relate back to. So what we do is hands-on massage techniques, which actually we're looking more to be creating myofascial change within the body and reconnect those myofascial chains and functional lines within the body. So that is very much what we are looking to do. So we treat the whole dog. So when we are assessing a dog, which we'll look at in a sec, using posture and the comfort scale, we are looking at the whole dog from a psychological and physiological and physical perspective. And this is really important because often our guardians say, well, that's the bad leg. Why aren't you treating the bad leg? Why are you treating this area? So what we do is we treat using our knowledge of fascial lines to be able to create muscle activation, myofascial activation through releasing other areas. And this we're very much guided on by the dog, as I've already said. So if there are any areas that are really uncomfortable or painful, we can report those back. But often by treating away from those areas, we can create the body can, we allow those myofascial connections to work, like we are changing the body's internal environment, and that's what we're planning on doing. So it's more how brilliant the body is at making these changes that can actually, given time and the correct exercise, can actually spread to other parts of the body. So that's how we work from a myofascial perspective. But having our hands on gives us another feedback mechanism. So we're not just looking at how the dog feels from a muscle tone perspective. And when they're in a relaxed state, of course, we get a really authentic feedback on that. But we can also feedback on temperature, hot or cold. I had a dog the other day that the lumbar region was really quite cold, which was quite alarming in such a young dog. The reaction to where we are treating, which is valuable feedback for all concerned, and any immediate effects and ongoing effects to the treatment. And it's fascinating because we give the dogs thinking time in between little mini sessions. They can get up and we can actually watch them walk and how they use themselves before they come back and have further treatment. So we get an immense amount of feedback that can be very, very useful to the multidisciplinary team, whoever that may be. And this is what we get throughout all our treatments. So mentioned about working with myofascial techniques. Fascia is something we've always been looking at from the very beginnings of Garland, when fascia was very, very little written about. Most of it was in the human world, but it was still evolving then. Now, what is wonderful, there's a lot more science within the canine world, even more within the equine world. But apparently, the human and the canine are more akin to each other than the equine with regards fascia. So that makes it interesting, and also has given us a lot of answers as to why dogs have responded or haven't responded in the way we were hoping or expecting. So fascia is considered a body-wide network. It interrelates and interacts with every part of the body, which is something that I think we're going to, well, I know we're going to be discovering more and more and more about, and the importance of that, and the importance of putting this within a treatment program, adding fascia within a treatment program, adding the knowledge of fascia and how it reacts within a treatment program. Here are just 4 things that I've picked out. The mechanical response is incredible and can be instant, how it can be very protective and go into a very dense state to protect the joints and the body, and then instantly release. All these studies are coming through, and it's just it's such a missing piece in rehab. It really, really is, and in pain and pain perception. So the body can, the fascia within the body can create these like sort of concrete overcoats to protect you and protect your body if you are overloading and gone into a bracing pattern. And these can be in themselves then create other compensatory and bracing pattern effects. So working with these and trying to mobilize these is very important, because that's one of its properties. But it can work positively and negatively. So positively by changing things within the house, these little tiny things I was talking about can positively affect the myofascial connections. The remodeling, it does take a while, but then again, we are looking at repatterning a whole dog if they have got quite extreme physical dysfunction. And that is quite something to look at 6 to 24 months, depending on what type of changes we need. So again, ongoing exercise and advice and support is really important to get to facilitate any change. And because we use the type of rehab exercises that are safe for guardians to use too, they can be done on a repetitive basis, which really does add to the dog's physical and obviously psychological health too. The slide and glide, this is definitely where we're trying to influence. And that really comes from the irregular fascia, the stuff that looks like spiders' webs, which doesn't look like it has a huge role within the body, but it really, really does. And it's been shown to be one of the most important parts, and it actually helps the tissues slide. So if these become dehydrated and they become basically immobile, the tissues can't slide. So we are looking to actually try and activate the active components in there. HI is another word I find difficult. HA, I should say, which is hyaluronic acid. It's really not meant to be said out loud, is it? And this helps with this hydration, and therefore can bring back and restore some of the elasticity and, of course, separation within the fibers. So really important. Force transmission, this is just a wonderful add-on. Again, human studies have shown that if these myofascial connections are connected without too much inhibition or without any inhibition, they can actually add 30% muscle force. So this is why we can see some dogs that they can walk wonderfully for a long time, or us, without fatiguing. And it's because they are utilizing all these functional lines within their body that creates that 30% potentially extra muscle force and drive. But of course, it means that everything has to connect both diagonally, dorsally, ventrally, and every which way through the body to create that. As I pertain to, we look at posture a lot. We always do a postural assessment before every treatment, because that gives us a really good idea of the potential no-go areas and where we want to start our treatment. But also it gives us a wonderful measurable outcome to do postural assessments before and after, which can be part of a report for, again, anyone in the multidisciplinary team. You can actually see the difference in the dog and translate that into the biomechanics as well. So there's just a picture on the left of human posture. Once you've started to look at posture in dogs, you become obsessed with looking at it in people too. But this is a very easy postural demonstration or a picture to view. I mean, basically this guy is like a lot of us and spends a lot of time on the keyboards. So the body is having to brace through this part, the shoulders, upper thoracic region. So it develops this hardened, sort of solid bracing type fascia, which is really stiff and immobile. And what happens is then the pectoral muscles become shorter and strong, and they become stronger. So it actually enables that bracing pattern. But of course, as you can see, it might affect one part of the body, but look how it's affecting the neck. It affects the lower back. It affects the position of the pelvis, the knees, and the ankles, just the same as the dog. So here are three very different postures that I've just selected. The little black dog has got that dorsal tilt. That can really create some quite extreme neuropathic pain down the pelvic region. And that's something that we can alert a paraprofessional to. And that easily could be the type of dog that we may not be able to get our hands on. Likewise, the dog at the top, the husky, sway back, real sway back, separation of the legs, really trying to avoid using their lower back, and heavily loading on the neck and through the neck and shoulders. Now, the one at the bottom, the bull breed, this is very interesting and something we see a lot, which is global muscle domination. Now, if you look at this dog, he looks like he's actually got good muscle tone, but if you feel the muscles, they are dense and non-malleable, unlike a healthy muscle. And this is how it differs so much from healthy muscle tone. But also you can see that there is an asymmetry between the thoracic and the pelvic region of that dog, but also the top line isn't good too. And this can be caused through many different things. A lot of global muscle domination we see through inappropriate exercise or activities, where these global muscles, i.e. hamstrings, quads, glutes, overdevelop because the stabilizer muscles haven't had the opportunity to kick in. So everything has to go into double roll mechanism, which creates this look and this posture. However, if this dog, who was actually very painful, is presented for a 10-minute consult, can be missed, because unless you're very conversant, with the feel of muscle and the look of posture, it can be something that can be missed from a neuropathic or pain perception perspective. And this is what brings me on to this slide. This is something that we see or hear about a lot, where clients have taken their dog because they know, the guardian knows, that there's something not right with their dog, and yet on immediate or instant inspection, there doesn't look like there's anything wrong with this dog at all. He looks very healthy. He doesn't look particularly over bulky or anything. I know it's only the front vision, but still you can tell a lot by head carriage and face and tail. So he looks good. However, there is something not right, and it's not until I can find my mouse, you home in on the feet, and then you can see how there's lateral rotation on the right side of him, and also a lot of splaying of the feet, which indicates a misdistribution of load. And likewise, if you actually look on the back left, having to reverse everything on the back left, you can see that he's standing very much on his back pad. And these are all the things that we look at, which give indication of where they are trying to offload, therefore where they are finding discomfort. But look up now at this region here, at the pectorals. Can you see how you can actually get a bit of a clear view of how that right leg is being lifted very slightly? And those are the key indicators that can really help with any veterinary diagnosis or ongoing treatment. So we don't just look at static posture, we look at dynamic posture too, and these can really give us very clear indications of where the dog is unable to support their load and where they are unbalanced, but what they can use to help balance them. So it really gives a very full picture. So the dog on the left, you can see, is really struggling to hold that static position for having a poo, and likewise having a pee. And also dogs, male dogs too, we see very different styles in how they cock their leg, and that gives us a huge amount of information as how they are perceiving their pelvic region, lumbar region, and also their sacroiliac region too. But the dog on the right looks pretty comfortable. She's performing these really important acts from a position of comfort, so is not going to be put off by needing to have a poo or a pee. It's not something that is going to have a deep effect on her because she feels comfortable doing it. And likewise, what we do see is sometimes dogs, they move, very often, in fact, they move when they're having a poo, but also a lot of dogs, like the left, can have anal gland problems too. So a lot of this stuff is very much connected with balance and the physicality of the dog. So this is a dog that I treated a while ago, diagnosed with lumbosacral disease, hideous disease, horrible. And the cruelness, I think, of it is that to actually create a supported bracing pattern to avoid the pain and discomfort arising from this disease actually exacerbates the discomfort from this disease, as you can see in this dog here. I mean, that would be the area that you would not want to put under load and strain, but that is exactly what is happening by this bracing pattern, which is an exaggerated version of the little black dog we saw earlier. But what I wanted to point out are the hamstrings here. Now, so often when we're looking at dysfunction, we think of a muscle loss. We see a lot more of hypertonic muscle rather than hypo. We see hypo too, but this is a big problem because these hamstrings have become so strong, so dense, and taken on that quality of fascia as I described earlier, that actually holds everything in that position because it needs to be able to support that posture. Well, that's what it thinks. But in fact, that is unhealthy muscle. And also, can you see that there are very lacking gluteal development here? So leaving a lot of exposure within that hip region, but also within that highly neural region too. So giving the dog a lot of extra potential discomfort and pain. As you can see in his face, he was very uncomfortable. Then, of course, the neck and the shoulders. I mean, the neck, anyone that's had neck pain, I get postural neck pain. It gives me horrific headaches and all sorts of other symptoms too, dizziness and all sorts of things. So I'm very empathetic towards dogs with postural neck pain. And this dog, I would think, it's difficult to know. He allowed me to treat his neck because he felt that was incredibly releasing. But look at the load over his shoulders. Look at the load through his carpals too. And come back to this. This is 4 treatments later. Look at the difference in his posture. But quite frankly, you don't really need to look at his posture. You just need to look at his face and how everything now fits much more easily. But if I very roughly fit a skeleton to those before and afters, I think they can really give a very clear vision of what he was going through before and now after. Now, this type of treatment needs ongoing support. So we do something like 6 to 8 weeks supporting treatment. But again, it's all about that psychobiology. I nearly didn't say it. The full 360. That's easier to say at this particular moment of the dog with the environment, exercise, everything else. That has a massive impact in this posture remaining intact, this good posture. Mentioned about ongoing exercises earlier and activities. Now, we do a lot of assessment through functional movement. We do gait, but really our big assessment is how a dog moves, how a dog can move with a presented obstacle. And the obstacle could be just going around something, stepping down off something really low. Just how they move, how they turn corners, those sorts of things give us huge amounts of feedback, because that is where we can assess what is functional on them and where they are dysfunctional. And these type of enrichment exercises that are used very widely and very successfully in lots of different modalities, we also use, and they work brilliantly with myofascial connections, or trying to work with the myofascial connections that we have worked on with our hands. So it can really embed better function. However, when we are giving this type of exercise to our guardians, we slightly change it from the other type of enrichments. We don't have any snuffle mats or anything like that which holds the dog still. We want soft, flowing, continuous movement with different angles of the head. We don't do a lot of high obstacles for dogs to reach treats. We do use treats. We do use other scents too, that if a dog isn't particularly engaged by treats, we use things like animal hair or other animal poo, that sort of thing too. Yeah, we're very dedicated to the cause. But just to encourage the head and the neck to perform natural, different movements, but they're not forced. So if they don't want to look or sniff in a particular way, they won't. Or if they use their body differently, that too is part of the assessment. So we like to see videos from our guardians to see how the dogs have worked with these. And that is a wonderful thing that they can do every day, which provides also a fulfilling experience. It can replace exercise or work, exercise, because it is so fulfilling. And actually, it's pretty tiring too. So we adjust each session for each dog that we are treating. The comfort scale is something that has been in development for well over 20 years. It's based on all of our observations over all the dogs we've treated, and it's been based on the behaviors that we have witnessed and how they have gone or been or lessened through treatment. So we have separated it into 4 different sections: physical, eating and digestion, behavior, and other indicators. Now, these aren't all the behaviors that we've seen, but these are some of the main ones that we see that really are highly relevant. And Jack talked about the pain scales and how important they are. And absolutely, I think the more we can get data for one thing, but also get something measurable, not just for us, but for the guardians, so they can see how their dog has improved, is just so valuable. And the thing about our comfort scale is that it is actually factual, so it's based on observations and doesn't rely on a guardian's perception. So it is actually looking at how the dog presents. And the other great thing is, as much as we would love all our guardians to be really good on the observations, to be accurate, it's not so important, because what we're actually teaching them to do is observe and the relevance of that particular observation. So they actually get better and better as time goes on. So we get more and more accurate feedback. And also we ask them to look at the dog over a week. And so they score the dog over the week. And so we get a much more average and much more accurate feedback from that. So in summary, and I will make it brief, we look at posture that is fantastic for helping interpret adaptations and therefore track potentially what could be the primary and then the secondary compensation, or what could be the primary cause and the secondary compensation. Plus, we can use these as plus and after, or before and after assessments. We do the full biopsychosocial details. We do the functional movement assessment, but also including that within enrichment, which is really important. And also we can look at inhibitions and instability. We get our hands on, so we can give anyone accurate feedback as to what the dog is perceiving within their own body, which is very, very helpful. And that also helps interpret the severity of pain, which is something that Jack was looking at too, that was something that he really needed within his assessment. So, and I know it would be subjective, but it could add to that puzzle. Measurable outcomes from, again, the posture and the comfort scale, and integrated rehabilitation approach. So we're actually looking to apply techniques and rationale to reconnect the whole body. So everything is there to reconnect the whole body. So we really are working on the dog as a whole and using our assessments to assess how the dog has reconnected. So what could be the barriers to really working to a closer integrative teamwork? I think the big thing for us, and this is based on our experience of what we have found, is time. Time, it's always time. I mean, money is another thing, but we'll look at that in a minute, but time. I know so many vets that would love to integrate other modalities within their care, but sometimes it's taking the time to introduce that modality to the client, to the guardian, and to actually express the benefit of how everyone would work together. And that's something I think that we could work together much better on. We're working with a vet at the moment, and we look to actually have a special page on our website so their clients can be sent there and actually see what they're getting. So, and how we work with the vets and everything. So everything's there, and it's up to us as teams to work together and work out ways that we can reduce the time, so we can add different modalities. Communication, that's just huge. Communication comes in so many different formats. What sort of reports do you want? Do you want reports? Do you want verbal reports? Do you want written reports? But also, if the report is written, we're always told, yes, we want a report, but do you read it? Is it actually, do you put it within your treatment? Do you give it any credence whatsoever? So again, two-way, we need to know that all our time and effort given a report, and I know it's not just us, reports should be read. They really should. However, reports should be presented in a way that that particular vet or vet referral wants it to be produced. So it could be, some people like pages, some people like just bullet points. We need to know that. So it's got to be absolutely relevant for each vet. The other thing is vets are not really clear on the levels of training and qualification for all AVPs. And that's sad, because I think so many well-qualified allied veterinary professionals miss out because their qualification isn't understood from a veterinary perspective. And that's something too that will be hopefully changed, but in the meantime, communication can help that. But we need to have the opportunity to communicate too. Awareness of the range of therapies too. And I know there's a lot, but there are so many therapies and modalities that could really add to veterinary care and add to each veterinary center. So we're working with you and to add to the outcome of the dog. And if the dog improves, then everyone is happy. So being able to evaluate the clinical contribution of each modality, that's a tricky one. But again, that can come with communication, but also that can come with better communication from the AVP to the vet too. But again, if we're supplying that, it's got to be looked at. So a lack of perceived measurable outcomes, I get that. So I'm sending this dog to you. What am I going to see as a result of that? And these need to be individualized, obviously, but also understood / explained. For instance, we get very excited if a dog hasn't picked up a toy for a year or even a few months and suddenly goes and picks up a toy. That is a measurable outcome. But it needs to be presented in a way so it can be understood and interpreted correctly within the treatment plan. So the other barriers are sort of the hardcore stuff, which is understanding liability. And I get that. If I give you consent to treat a dog who's liable, so it's understanding that accountability of the therapist and the insurance, but also the professional body affiliations, complaints process. All of these things are really important if you are handing a case on to another professional. And of course, I have heard in some cases that some practices are very worried about losing business. I would conflict that completely. And from the conversations that we've had with guardians, if practices are open to working with other modalities, and if they don't particularly want to work with a particular modality, to have a rationale for that, that really adds their credibility and people stay loyal to that practice. Now, that's only from my perspective, and we do hear a lot of stories of communications between vets from guardians, but also therapist communications too. So that sums up my presentation. I hope it was useful. There was a lot of information to try and squeeze into a small amount of time. If you're interested in finding out more, here are all our links. And just to say that I am very much looking forward to the future of this collaborative working and improving the lives of our dogs.